This is the fourth lecture on common injuries of ankle and foot. In this video, we will discuss about policeman's heel and turf toe. Firstly, the policeman's heel. Other names for this condition are fat pad contusion or bruised heel. A policeman heel is injury to the soft tissues in and around the heel, causing bleeding under the skin, though the skin doesn't break. Mechanism of injury. Normally, the heel bone is protected by a pad of fatty tissues. This fat pad acts as a shock absorber for the heel, protecting the calcaneus or heel bone. Repetitive impact to your heel causes the fat pad to flatten and be displaced sideways. As a result, this leaves a thinner protective layer, resulting in bruising to the heel bone. A bruised heel will look something like that. Now, causes of a bruised heel. The primary cause of a policeman's heel is overuse injuries. A bruised heel is usually caused by overuse with activities such as repetitive jumping, long distance running, walking, or landing heavily on your heels. There are a number of other factors that may also contribute, including poor footwear, that is, if you wear hard, flat shoes with little or no cushioning at all, and the training errors. Management of the policeman's heel. The immediate treatment of a bruised heel is the price protocol, that is, protection, resting, icing, compression, and the elevation. Insoles and heel pads, including gel heel pads or donut pads. Taping. Taping could also be done. A simple heel taping technique will compress the fat pad and provide increased cushioning and protection. Therapeutic ultrasound. It will control signs of pain and significant inflammation. Cold laser therapy makes the healing process faster. Footwear. Wear soft trainer shoes with lot of cushioning in the midsole. Note: if you catch a bruised heel early, then it should recover quite quickly, usually within a few days. However, if you ignore the early signs of pain, then it can be very difficult to treat. This is due to the fat pad becoming damaged beyond the easy repair. Moving towards the other injury, which is turf toe. Turf toe is the sprain of the ligaments around the big toe, that is the first metatarsophalangeal joint. Mechanism of injury. The most common mechanism of injury in turf toe is hyperextension of the big toe, where the forefoot is fixed on the playing surface with the heel raised in a dorsiflexed position. This often occurs in kicking an object, stubbing toes, dropping heavy object on the big toe, fields with turf. Symptoms: pain. Pain which could occur during push-off phase of the gait, active joint motion or manual resistance, or while attempting to quick stops. Point tenderness over the metatarsophalangeal joint, limited range of motion. Treatment would involve price protocol for the immediate pain and swelling relief, taping and bracing, therapeutic ultrasound for pain and inflammation control, and NSAIDs.